How you doing today?
Well,
What's your name?
Danielle.
Daniel. Okay, I'm Anthony.
Hi, Anthony.
Yeah, you call me Mr. T.
Mr. T.
Yeah. What brings you in today?
I am experiencing some pain on, I don't know what this is, this side of my leg.
Okay, I got you. If you could just sit down for me.
Okay.
All right. What sport do you play?
I'm actually a cyclist, so I ride my bike.
So how often do you do this?
At least 5 times a week. Yes, sometimes on the weekends.
Gotcha. Gotcha. So like, when did this pain start occurring?
Honestly, it hurt, but I just kind of ignored it. It wasn't like as painful, but now I can't ignore it anymore.
I got you. So like, could you guesstimate like how long, like time?
Probably about a month.
About a month, okay. All right. Does it feel any like better at a certain time of day?
Just when I'm not cycling.
When you're not cycling, got you. And does it feel worse at any time?
When I'm climbing steps.
Okay, so climbing steps makes it worse. You've been taking any like medications?
No, sir.
Anything? Okay. And, have you ever had like anything like this happen before?
No, I haven't.
And you haven't like switched up any of your training in the past month?
I actually changed my bike. I used to ride a bike that was lower when I was pedaling, but
Okay.
now this bike is higher. Yeah.
So you sit higher on it?
Yeah.
Okay.
Mhm.
Okay. Um, you haven't changed any like shoes or anything,
Yeah.
but just your bike is on.
Yeah, I changed my shoes, but
That's true. I get you saying that. And could you just point with one finger like where the pain is coming from? Right there. Okay. And is it what kind of pain is it? Is it like radiating, sharp, dull?
it's radiating because it starts like when I'm on the bike, it starts up here and then it just shoots down here.
And what side would you say your dominant side is? So like
My left side.
your left side? Gotcha. All right. So I'm just gonna take a little bit of time and just observe both legs for
Okay.
a second. See if there's any differences.
Okay.
All right. And then if I could just get you to swing your legs up on the table for me. Appreciate that. Okay. So now all I'm gonna do is just do a couple palpations, which is just I'm just gonna feel, make sure your structures are okay, see if there's any pain anywhere.
Okay.
Okay, so I'm gonna start on the uninjured side first, and then just show you what I'm doing,
Okay.
and then I'll move to your injured side.
Okay.
So I'm palpating right now. I'm palpating your IT band, just seeing if it's tight or anything, and there is a little tightness there. Now I'm gonna move over to your quadricep muscles. Just see if there is any tightness, any strain. And I'm gonna move down to your quadricep tendon, onto your patella.
What's patella?
It's just another word for your kneecap.
Oh.
And then move down to your patella tendon. It's just the tendon that connects to your patella to your tibia.
Okay.
And then move down further to your tibia, as well as your fibula. Okay, any pain anywhere?
No, sir.
Gotcha. Now I'm just gonna do the same exact thing. On this side. Just tell me if you feel any type of pain.
Okay.
Right there?
Yes, sir.
Okay, is it really tender right there? How would you rate your pain?
Right now, what you touching it?
Yeah.
A 9.
A 9?
Mhm.
Now how is your pain when like you're just walking around doing
Like a 7.
like a 7?
Yes, sir.
Gotcha. So, how does that feel?
Not as bad.
That's bad. Gotcha. Anything down here?
No.
Your bag for me?
Oh, nothing.
It's just right in this area.
Yes, sir.
Gotcha. Alright, now I'm gonna have you flip over for me.
Okay.
I'm gonna continue with some palpations. Alright, I'm gonna go down your hamstrings. You feel pain?
Yes, sir.
Okay, same spot?
Yes, sir.
Gotcha. Any pain here?
No.
In your popliteal space, that's what we call it.
Okay.
And then how about in your calf? Other known as your gastro?
Oh, no pain.
No pain. Anything down here?
No.
Gotcha. And how about over here?
No.
Okay. So you can go ahead and flip that over for me.
Just fell off the table.
Could I have you take off your shoes for me?
Sure. Ah.
That kind of hurt when you take off your shoes?
Yeah, I just the shoe just hit my toe just now. It hurt.
I got you. Just get down at your feet and palpate some of these structures.
Okay.
So this is your lateral malleolus.
Okay.
Which is just the end of your fibula, which is lower leg bone.
Okay.
Or one of the two. And then here's your medial, which is just the head of the tibia, shin bone. Any pain or anything? No. How about on this side?
No, sir.
Gotcha. Alright, so now if I could just get you to do a few movements for me.
Okay.
Alright, so you can stay seated.
Okay.
So can you just kick your leg up for me? Your uninjured leg first. Okay, and then now you're injured. Any pain?
A little on the side.
A little bit. Okay. Now, I want you to flex for me, or bend your at your knee, and then don't let me pull you up.
Okay.
Ready? Go.
Mhm.
Good, good. All right. Same thing over here.
Okay.
Ready? Go.
Ooh.
All right.
Yeah.
Gotcha. And where would you say that pain is, like when you're going through those movements?
Just again on this side.
Same spot, same area,
Mm-hmm.
radiating as well.
Yes.
All right, if you could just lay on your stomach for me. Actually, I'm sorry. Can you actually sit back down?
Okay.
I'm sorry about that.
I just fell off again. Oh well.
Or just come scoot to the end some more. Gotcha. Now just relax.
Mhm.
And I'm just gonna put you through these motions. How's that feel?
It's just tender on the side.
Got you, but it's not. Would you say it's the same pain?
No.
Okay. Cool. Just gonna do the same thing on this side. How's that?
It's fine.
Gotcha. Okay. Gotcha. So I'm just gonna put you through a couple of tests
Okay.
real quick. If you could lay on your left side, no, your right side. I'm sorry about that. Yeah.
Like this?
Yes.
Okay.
So this test I'm about to do is called the Uber's test. Uber's test.
Okay.
I'm just gonna test for a couple of things. So just relax for me. Okay. Relax for me. Okay. Gotcha. Okay. Now this next test I'm gonna do is called the Noble's compression.
Okay.
So just as I extend, as I bend your knee, just let me know if you feel any pain up where my thumb is. Okay. That hurts. Gotcha.
Yeah.
Okay. Okay. If you could just stand up for me. And then I'm just gonna have you stand on your injured leg for me. If you just need somebody to balance. Okay, now I want you to bend at the knee at about 30 degrees. That's good. How does that feel? Pain? Gotcha.
You heard that pop?
Yeah. Okay, so there's a little pop there as well. Okay. So if I could just get you to lay back on the table for me.
Jesus.
Could you actually all lay down for me?
Let's lay down.
Yeah. Okay, and then just scoot. I need you to scoot this way from me. Not all the way out. Just a little bit further this way. Gotcha. is called the VAD stress test. I just want to make sure your LCL is okay. How does that feel? A little bit of pain there. Gotcha. Don't feel too much laxity,
Okay,
which is a good thing.
good.
But you said there was some pain. Okay. Now, I'm gonna check posterior. Now this is called the reverse pivot test.
Okay.
And we're just testing your posterior lateral corner.
Okay.
So we're gonna externally rotate. How does that feel?
Hurts kind
Okay, gotcha. Alright, you can go ahead and sit up. I think I have an idea. What you may have. So just, with your complaints of a little bit of tightness and just a lot of pain, as you walk and things of that nature, and seeing the fact that you're a cyclist, I believe that you have IT band syndrome.
Oh, okay. What's
Yeah,
that?
it's just basically it's the inflammation of your IT band, it's going over your femoral condyle.
Whoa, wait, what is that? What's inflammation and what is for?
Inflammation, so it's just like inflammation is, trying to put it in layman's terms for you. It's kind of like a swelling,
Okay.
almost of your band.
Okay.
That's running. It runs exactly where your pain is going.
Okay.
It's just from just constantly cycling, moving over a bony landmark.
Okay. And the bony landmark is what?
Your femoral condyle.
Okay.
Wow. But yeah. You have any questions?
No, about how long do I need to sit out and not cycle?
I would give it about 3 to 4 weeks of rest.
Okay.
You can come in for treatments, of course.
Okay.
Definitely some stem and ice will help.
Now, is there anything I can do besides cycling? Like, can I still walk or?
Oh yeah, you can still walk and
Okay.
go about your day. I would just, if you do plan on cycling, I would definitely cut back a
Okay.
lot. But yeah, a lot of rest, ice, compression.
Okay.
Yeah.
All right. Thank you.
No problem.